For these Montrealers, following public health guidelines means staying in the cold and making the most of it.
Just to see people coming back and with a tan, that's kind of frustrating, yeah.
I traveled a lot before the pandemic, so I understand that it's something that people want to do in winter.
But those who do travel could actually get up to $1,000 when they return to quarantine through a federal program. The Canada Recovery Sickness Benefit is meant to cover workers who don't have paid sick leave and may need support while they self-isolate due to the virus. Those who meet the program requirements are eligible to receive $500 per week for a maximum of 2 weeks. That, in theory, includes travelers.
I think it's sending exactly the wrong message. It's a little bit like, do something bad and you're going to get the gift.
The federal employment minister is already trying to make changes, saying the program was never intended to incentivize or encourage Canadians to not follow public health or international travel guidelines, and we are actively looking at all the available options to address the issue. Opposition politicians are calling on Ottawa to move fast.
It's completely unacceptable given the surging second wave, the new COVID variant. We don't know how many non-essential travelers might try to exploit the loophole, but it needs to be closed, and it needs to be closed firmly now.
Other MPs say it's not fair for those who followed public health recommendations.
There's a lot of people who canceled their flight, canceled the trip that they had planned, and did not even get their money back from the airlines.
Already, the rules for air travelers are tightening up. Starting Thursday, Canadians returning home will have to test negative for COVID-19 before they can enter the country. Valeria Corey-Minocchio, CBC News, Montreal.
Let's bring in infectious disease specialist, Dr. Lenora Saxinger. And Dr. Saxinger, you tweeted on Saturday about all the restrictions so many people are living under, including yourself, and your frustration with the reaction to this news of people traveling abroad. Tell us more about that.
Well, I guess I do find it quite disappointing because, we were seeing our highest case numbers in Alberta ever at the early part of December. And we're just seeing cresting numbers in hospital right now. And a lot of healthcare workers are under a lot of stress because of that. And so I found it disappointing that people wouldn't kind of obey the spirit of their restrictions a little bit more closely, especially people who are in a position of leadership.
So, of course, what these politicians did was technically legal, but strictly from an infectious disease physician standpoint, what would your recommendation be on international travel?
I really think people should be curtailing all unnecessary travel, and I think that it's really important to actually think about what necessary means when we have systems under so much stress. If you carry infection to the place you're going, you're putting their system under more stress and endangering others. If you bring in infection back, you are actually adding to your own risk, the risk of your family, and the burdens where you're coming home to. So I really think people should be looking to stay put while the vaccine is rolled out, and look forward to traveling more when it's safer.
All right, Dr. Saxinger, we'll be talking to you again later in the hour. Thanks.
Thanks.